So I guess you're there.
Thank you.
Again, this is the hearing on proposed adoption of Oregon Administrative Rules 333-019-1025 related to the adoption of spaces in Oregon. Everyone has been muted, and we ask that you remain on mute until your name is called to speak or until we open the floor for testimony, please.
What? Am I checked into this conference call?
Yes, good morning. We are asking that everyone remain on mute until your name is called to testify or until we open the floor for testimony.
Can you hear me? This is Scott Stewart. Can anybody tell me what order and where I stand in the oral testimony?
Scott, I'm looking at the list right now, but I'm to the number of participants we have joining. I'm not really able to provide a certain time slot for people to speak.
Okay, so how many speakers total are there?
All right, good morning, everyone. We're still having some people join, but we can go ahead and get started here. All right, just a few housekeeping. Just a few housekeeping items before we get started here. This hearing is being recorded and transcribed. And we ask that everyone remain muted until your name is called to speak or until we open the floor for additional testimony. We've also requested that cameras be turned off in order to protect bandwidth due to the number of people on this call. We have disabled cameras, but if your camera is able to function, we ask that you please turn that off. If you need to use live captioning, there is an option. We do have the transcription going, but if you would like to use live captioning, there is an option at the top of the screen. There's 3 little dots for more actions, and if you click on that and scroll down, you can turn on live captions. All right, I'm going to go ahead and get started here. Jody, it looks like you have your hand up. Do you have a question?
Yes, I wanted to see the closed caption, and there are not 3 little dots at the top of my screen.
Okay, I'm sorry about that. We will look into how to get those captions for you.
Okay, thank you.
Yeah, I apologize about that. Okay, I'm going to go ahead and get started here since we have a lot of people signed up to testify. My name is Brittany Hall, and I've been designated as hearing officer for this rulemaking hearing. I would now like to call this hearing to order. Let the record show that the time is approximately 10:08 a.m. and the date is January 20th, 2022. The purpose of this hearing is to receive testimony regarding the Oregon Health Authority Public Health Division's proposed permanent adoption of OAR 333-019-1025 pertaining to masks being required to be worn in indoor spaces in Oregon. Oregon Administrative Rule 333-019-1025 is a temporary rule requiring masks, face coverings, or face shields to be worn in indoor public settings. It was adopted in August 2021 in response to the rapid spread of the Delta variant of COVID-19. Under Oregon Revised Statute 183.335, temporary rules cannot be extended past 6 months. Thus, temporary OAR 333-019-1025 expires on February 8, 2022. OAR 333-019-1025 has entered into a permanent rulemaking process in order to extend its protection past February 8, 2022. That does not mean the rule will be in place permanently. The Oregon Health Authority can rescind, repeal, or cancel a rule when it believes it is no longer necessary. Testimony will be received of all persons who have signed up by letting me know that they intend to present oral comments. If you did not have a chance to register to testify ahead of time, I will ask if there are others who would like to comment after we have gone through the list. You may also send an email to publichealth.rules@dhoha.state.or.us during this hearing to be added to the list. Please provide your full name, address, affiliation to an organization, if applicable, and your position on this rule. Again, that email address is publichealth.rules@dhoha.state.or.us. We have 125 or so people who have registered to testify so far, and we'll do our best to keep up on that email address if you'd like to be added to the list. And again, I will open up the floor for additional testimony once we've gone through the list. Persons wishing to testify shall first state their names and that of any organization that they represent if they would like to have that on the record. The agency will not respond to questions during this hearing. The agency will not cross-examine or debate the material at hand. There will be no discussion about the proposed rules at this hearing. Testimony is limited to the matter at hand and must be relevant to the proposed rules. The hearing officer may exclude or limit cumulative, repetitious, or immaterial testimony. Please do not comment on the proposed adoption of permanent rules for masking and vaccine requirements in schools and healthcare settings. Those rules have separate public hearings and are not relevant to the indoor mask rule. Written testimony is encouraged. The deadline for written comments is 5 p.m. on Monday, January 24th, 2022, according to the notice of this hearing. Comments received after the deadline will not be reviewed or considered by the division. Because of the large number of people who have signed up to speak, we will limit your comments to 3 minutes, but request that you be as brief as possible. You will hear a timer go off when your 3 minutes are over, and you will be asked to quickly end your comments. The agency reserves the right to place someone on mute that goes significantly over the 3-minute limit in order to be fair to everyone who would like to speak. Again, you may submit written comments up until the close of the public comment period. This hearing is being recorded. Copies will be available at the division's cost for reproducing the recording upon request. And finally, the Oregon Health Authority will not tolerate any comments that involve the use of profanity or any threatening remarks and may mute an individual who uses profanity or threatening language. We ask that you are respectful of everyone who is on this call. And again, as I mentioned at the beginning, we have asked that people remain off camera and remain muted until it is your turn to speak. All right, I'm going to go ahead and open up the floor for testimony by reading names on the list here. The first person that I have signed up is Matt Runkle. Please unmute yourself and state your name and provide your testimony. Do we have a Matt Runkle on the line? All right, I'm going to move on down the list. I will come back to people that may not be on the line when I initially call their name. And I apologize in advance if I mess anyone's names up, which I'm sure I will. The next person I have on the list is Aiden Nepom.
My name is Aiden Nepom. I live in Westland. I'm a consultant for some of the world's biggest brands on interpersonal dynamics, communication, and leadership, who has, like many members of the community, taken a particular interest in public health. I want to say thank you to the members of the Public Health Division for hearing my testimony today. You're probably in for a long several hours with the number of speakers on the list. I'm strongly against the proposed rule to make masking permanent for many reasons, and here are just two. By passing this rule, you will change the timing from definite to indefinite, which will eliminate important checkpoints and public input. And my other reason is because it goes against my needs as a citizen here in the state of Oregon. Let's start with the first. Up until now, masking was a temporary measure re-examined and renewed every 180 days. This puts a forcing function of time into each mask mandate, requiring you to look at current evidence and hear public opinion. Even as a manner of ceremony, by passing a permanent rule, you eliminate these critical checkpoints during what is still a rapidly evolving situation. Just yesterday, the UK and Czechoslovakia announced that they're doing away with most COVID-related mandates, say for isolating when you are sick. OHSU is projecting that COVID hospitalizations in Oregon are likely to drop back down by
I'm sorry. Aiden, I'm not able to hear you. Are you able to unmute yourself? I'm not sure what happened.
Yeah, sorry. So should I start over then? I was unmuted, I thought.
Did you get in?
Can you hear me
Yeah.
now?
Yes, I can hear you now, and we heard you up until the part where you were talking about the changes in the UK. I'm sorry about that. I don't know what happened.
No worries. Sure, I can go back. Yeah, so I was just talking about how OHSU's projections are that COVID hospitalizations in Oregon are likely to drop back down by February as the Omicron wave comes to an end. And at that point, even to the most fearful among us, wearing masks could and should feel ludicrous, actually.
I can barely hear him.
Really? I can try putting on a headset.
I hear you fine.
I hear you fine.
I hear you fine.
I hear you.
I can hear you.
I can hear you.
Everyone can hear
Party
you.
that reported couldn't hear, turn up your volume.
Okay, I've now switched to a headset. Is this better?
Perfect.
Okay, great. Thanks. I feel
Good.
silly repeating myself, but I guess if you haven't heard it, it's not really repeating. So I'll come back to, and I hope this won't negatively affect my time here. OHSU is projecting that COVID hospitalizations in Oregon are likely to drop back down by February, as you all know, as this Omicron wave comes to an end. And at that point, even in the most fearful among us, wearing masks could at that point and should at that point feel completely ludicrous. The fact is that putting masks on healthy people so that they cannot spread a virus they don't have is probably fair to say 0% effective at promoting public health. Now, that's sort of beside the point, because my concern here, with all due respect, is at taking you at your word that you will continue to look at current evidence and context if you adopt a permanent rule that removes the forcing function of time. Your own list of supporting documents for this proposed rule contained outdated information, broken links, and a few other problems I don't have time to go into. It is surprisingly easy for matters of importance to slip through the cracks. And by eliminating these checkpoints, worse than that, you also abdicate responsibility for what we are doing here today, which is hearing the public's voice. Regardless of simple public health intent, removing that has the chilling effect of telling concerned citizens that our voice doesn't matter and that we should do as we're told. As policy leaders, it's important for you to understand the needs of people, and it's your job. My second point is that I will always personally be pro-choice when it comes to medical intervention. I believe it is well past time for mandates requiring citizens to attach a medical device to their face to simply to be able to, pardon me, I believe it is time for the mandates requiring citizens to attach medical device to their face. I think it's time for those mandates to go. Allow small businesses, school districts, and citizens to make the masking decisions that make the most sense in their specific communities and circumstances so that we can stop trying to stop COVID, which is a fool's errand, and begin trying to figure out how to move forward as a state, promoting physical, mental, and social well-being amongst the population as we move forward with COVID as a reality. I appreciate you hearing my comments today, and I have no idea if I used all of my time, additional time, or not enough time, but that'll bring an end to my comments. Thank you.
All right, thank you. Has Matt Runkle joined the line? I see his name listed. Matt Runkle, if you are on the line, you can unmute yourself and provide your name and comments, please.
As
Matt
a side
Runkle?
note, can I mute and not set off your timers? Go ahead and let the host do that. It really makes it disruptive.
Matt Runkle, are you on the line and would like to provide comments?
Can you hear me?
Yes, I can.
Okay, sorry about that. Hi, so yeah, I'm against the OHA's proposal to make the statewide indoor mask mandate permanent. The current policy is not based on science, but rather on opinion. And honestly, this opinion is very narrowly formed, influenced by public health experts with questionable motives. In addition, it's failing to take account of the actual lived experiences and beliefs of a large number of Oregonians. The state has not provided sufficient evidence to support such a draconian measure, apparently because such evidence does not exist. There is an overwhelming amount of data that casts doubt on the effectiveness of masks at preventing the spread of viral respiratory pathogens, data going back decades. And now, after nearly 2 years of living with this particular virus, which continues to spread regardless of state efforts, we still don't have sufficient evidence to justify a blanket mandate. It's notable that 42 out of 50 states, the vast majority, have chosen to instate no mandates at all. And there are no discernible differences between their rates of hospitalizations and deaths and our own here in Oregon. As an essential worker who has worked through much of the past 2 years in settings where I've been required to wear a mask, I'm here to tell you I can't do it anymore. I've hit a wall. I think we need to stop and take account of the things we are giving up by obscuring our faces, which are such an essential part of being human and connecting with others. And we need to acknowledge that there are real consequences in continuing to enforce such a harmful policy. I'm tired of being assumed sick until proven healthy. I miss being able to breathe freely. I miss being able to communicate unimpeded, to express myself fully, and to accurately read others' facial cues. I'm tired of having to ask others to repeat themselves, a truly draining experience when you do it all day. I'm tired of having to police others for noncompliance, something the state has outsourced to low-wage workers without any compensation. I know I'm not alone here. Continuing to wear these dehumanizing masks is putting us all through an ongoing experience of trauma. The damage being inflicted on children through these policies is incalculable. We are profoundly failing this generation, and their anger will be very justified. The OHA needs to take account of the poor health outcomes fueled by fear and stress that are happening because of such disastrous policy choices. History shows that whatever powers we let the government claim in the name of health and safety, even if it seems like something as small as just wearing a mask, will continue to be used against us in increasingly oppressive ways. We are setting a very dangerous precedent by making permanent this so-called state of emergency, which appears to be nothing but a means to endless authoritarian overreach. And I'm going to include a list of 12 peer-reviewed studies pointing to the uselessness of masks in my written testimony. Thank you.
Thank you. I also wanted to mention again, for those of you who may not have been on the call in the beginning, we are allowing 3 minutes per person, and I do have someone else helping with the timing. So someone other than me as the host will be running the timer. And when you hear the timer, we ask that you quickly wrap up your comments. We'll allow another 30 seconds or so, but if anybody goes significantly over their allowed time, we will mute you so that we can be fair to everyone that has signed up to speak today.
Can you make sure everybody mutes, please?
Yes, we've muted everyone, and I've requested that everyone remain on mute until their name is called or it's their turn to speak. The next person I have on the list is Cyril Collier. Do we have Cyril Collier on the line? If so, please unmute yourself to provide your full name and testimony.
So my name is Cyril Collier, and I just wanted to give a different point of view that I think people aren't taking into account. So I have chronic lung disease. Currently, I have about a 40% capacity to breathe from a normal person. And I have tried to live by the mask mandate, but let me tell you what happens when I wear a mask, because it's hard to breathe. And when I am walking in a store, I have to stop every few minutes because I can't breathe through the mask. And I think I've tried to get a doctor's okay to not wear a mask, and I have that, but people judge me all the time. In fact, people say that I'm trying to kill people in the store if I ever take the mask off so I can breathe. Sometimes I almost pass out. I've talked to others that have the same challenges that I have from a lung perspective. And it's amazing the kids that have the issues as well, and the ridicule that they're being suffered because of their disability. So this mask mandate is really putting a disability on myself and making it where I can't breathe, I can't go out, I can't experience life. So I think you don't think of those things when you're thinking of these things that you're putting into place. So I'm begging you, please, to not make this a permanent rule, because there's unintended consequences that I think you don't think about and don't require. Furthermore, there's many people that say the cloth masks are little more than a face decoration. There's no place for them in light of the Omicron variant. It's not helping, so let's stop the charade. Thank you.
Thank you. The next person on the list is Kamala Patti, or Patty, and I'm sorry again if I'm messing up anyone's names.
No worry. This is Kamala Patti. I want to thank you for giving me the time to speak. As a 62-year-old native-born Oregonian, I urge you to cease going forward with your rule of permanent indoor masking. Rumor has it that you're going to be going forward with this despite major public outcry. And by what criteria would be used to determine when this ridiculous proposition could end? We are one of 6 states only with indoor mask rules. Science says that masks do not stop viruses. Science says that masks inhibit normal breathing. I suspect science will say that these masks will cause psychological damage. Forcing children to wear them is abusive. This damage may be irreparable. This is a violation of our God-given right to breathe, and also a violation of our civil liberties. This idea is both reckless and foolhardy. My request has become a plea. My plea is now a prayer that you act with humanity and God-given discernment. I also want to mention that exposing all the emails of speakers was reckless and could put someone in danger. I want to thank everyone for their time, and I reiterate my opposition to this foolhardy plan. Thank you.
Thank you. The next person on the list is Edie Van Ness.
Thank you. I'm here. Can you hear me?
Yes, I can.
Thank you. I'm a wife, mother, daughter, and proud native Oregonian, as well as a fully boosted individual who has never gotten COVID. Last spring, I, along with several other volunteers, successfully scheduled vaccine appointments for over 500 seniors who had been abandoned and deprioritized by the state, county, and city. In fact, I was on the front page of the Oregonian.
When it's my turn, I hit my RL, that's me, and then unmute myself here.
No, I need to remind everyone to please remain muted until it's your turn to speak. Edie, I think I just muted everyone. If you can unmute yourself again to speak.
Yes, I can. Thank you. If you can reset the timer, that'd be great, since I just started.
Yeah.
Last spring, I, along with several other volunteers, successfully scheduled vaccine appointments for over 500 seniors who had been abandoned and deprioritized by the state, county, and city. In fact, I was on the front page of the Oregonian for my volunteerism. I say this not for praise, but rather to show you that I'm someone who has taken this very seriously and followed all the rules. However, I no longer have any faith in OHA and the mask mandate today. And before you tell me that a permanent mandate can be canceled at any time, I don't care. It is time to start living with COVID. As each strain becomes less severe and the vast majority of people who get COVID, which is frankly everyone I know now, all vaccinated, we need to resume life, to prioritize our small business owners and our children. As the CDC acknowledges, even most seniors fully recover from Omicron. And as Dr. Fauci has said, masks don't work. Despite OHA's continued inflation of numbers, those of us who think critically and follow the science know the truth. As we have witnessed these mandates decimate our beloved small businesses and permanently damage the psyche of our kids, it is time to start living with COVID and resume life. Anyone who wants to wear a mask is welcome to, and we will all be sensible, but enough is enough. And you all should know that the longer you impose these irrational mandates, people are just going to start ignoring anything that you say, including wearing a mask. You can be reasonable or you can continue the theater and guarantee that Oregonians will stop listening. Why must you end mask mandate? One word, equity. Given that our elected Democratic leaders consistently prioritize equity, it is ironic that you want to impose an unequitable law. My husband, who works in a cubicle, is forced to wear a mask 9 hours a day while his boss in an office doesn't. My child has to wear a mask 7 hours a day, including sports and outside, when teachers and administrators have breaks throughout the day in privacy maskless. I get to enjoy dinner or happy hour free of a mask, while the servers and busboys must keep them on their entire shift in hot kitchens. Just last week, I learned of yet another child suicide. Our children are suffering. They're not learning, they're not socializing, they're eating outside, they can't learn with masks. What about our deaf kids? Governor Brown confirmed that masks do nothing when she chose to attend a DC gala along with more than 1,000 others, all maskless. Who in that huge ballroom was masked? The help. There were 600,000 COVID positives in DC at the time she was there, far more than we have ever had in Oregon. And yet she didn't feel compelled to wear masks because masks don't work. For the first time, and if I could just wrap up here. As I have little faith you will take anything I say seriously, I will say something that will matter. For the first time in decades, tens of thousands of Oregonians like me, lifelong Democrats, will no longer vote for Democratic leaders. And for the first time in my life, I would rather consider a Republican who is going to save our state and prioritize small business owners, parents, and children than vote for a party whose policies are running the state into the ground. Please, I encourage you to prove me wrong by showing courage, by standing up and ending this theater that is mask mandates. Stop treating us like children and start caring about our children. Do what's right for Oregon. Thank you.
Thank you. The next person I have on the list is Angela Todd. Angela Todd, if you are on the line, can you please unmute yourself and provide your testimony? All right, I'm going to move on to the next person on the list, Aaliyah Knight. Do we have Aaliyah Knight on the line? If so, please unmute yourself and provide your testimony.
All their names again, so that if they can get on.
All right, the next person I have on the list is, I'm sorry, go ahead.
Sorry, do people know to hit *6 to unmute themselves?
On.
How do we unmute ourselves?
All right, I'm going to continue moving down the list. I'll come back to these people. Lucas Weiss.
Can you hear me?
Yes, I can.
I, a man, Lucas Weiss, state, in over 50 years of medical science done on the topic of mask effectiveness, the great majority, over 95% of studies, show conclusively that masks do not stop viral transmission, and they can increase fungal and bacterial infection, as well as hypoxia, which hurts immune and cognitive function. The reason that masks don't work, and increasing evidence is showing this to be particularly true with COVID-19, is that virus transmission happens mostly through aerosols, not droplets. It's not through coughing and sneezing. It's happening through the aerosols, and the aerosols are particles so small that they pass freely in and out of any mask, even N95 masks. And because they are so small and so light, they linger in the air for up to 2 days. So only a properly fit respirator would stop the transmission. So we have a 100% cost, 0% benefit situation here with the mask mandate. They cause harm, physically and psychologically, and they provide no benefit. So the real question here is, are you going to implement a law or rule that causes harm to everyone involved or not? And to just finish, I, as a man, would like to address the men and or women who would be responsible for implementing this mask mandate directly. I have conclusive evidence that I have emailed to you that masks cause harm and no benefit. I ask, do you intend to do harm? And do you understand the consequences of causing harm? And is that something that you, as a man or woman, are willing to take responsibility for? Thank you.
Thank you. The next person I have on the list is Christina Buehler.
Hello?
Hi, we can hear you.
All right, thank you. My name is Christina Buehler, and I live in Tigard, and I'm a stay-at-home homeschooling mom. I am against the permanent rule that all people in Oregon should be masked indoors because for many reasons, but when looking at should OHA make this a rule, I went and looked at the Oregon Health Authority's vision statement and their mission, which is what every organization should do before they make a rule or a goal. And the Oregon Health Authority claims to respect diverse health practices. In Oregon, many people practice natural immunity boosting as a health practice. It's against their health practice to walk around and prevent environmental microbes into their system through their mouth and nose. And according to this practice, you must come in contact with germs in order for your body's natural immune defense to learn how to fight them. The Oregon Health Authority claims to protect mental health. A permanent mask rule should not be instituted without an honest look into the rise of mental health problems. Without a clear statement from the Oregon Health Authority, including data, which you're in charge of collecting, to prove the mask rule is not causing any rise in mental health, you are failing at your mission. The Oregon Health Authority promises effective solutions. While a face mask might prevent some microbes from entering our system and therefore dumbing down our immune response, it doesn't prevent COVID-19 virus particles. Therefore, the mask rules are not an effective solution and you're failing at your mission. The Oregon Health Authority promises for decisions to be informed. The permanent rule provides no guidelines for removal, and creating a permanent rule with no guidelines to have it become voided is not an informed decision. It is a one-size-fits-all rule with no backing to reason or logic and fails your mission. The Oregon Health Authority promises to discuss decisions with all stakeholders. This is not a discussion. You are failing your mission. Another promise value from the Oregon Health Authority website includes openness to try new ways. As we look at the number of COVID cases across the country, especially in schools that never had any mask rules, and we see that the results are no different, you're not taking any of that data into account and creating a permanent mask rule anyway thumbs its nose at your own value of openness to new ways. Creating this permanent rule after public care via phone only, and only allowing people to sign up for comments for 3 minutes does not constitute meaningful opportunities to provide input, which is also listed as a core value on the Oregon Health Authority mission website. It seems unlikely that the Oregon Health Authority could possibly maintain its mission and core values and the public trust and create this permanent masking rule.
Thank you. The next person I have, has Angela Todd joined the call? Is Angela Todd on the line? Do we have Aaliyah Knight on the line? If so, please unmute yourself to provide your testimony. The next person is Elizabeth Moore. If you're on the line, please unmute yourself and provide your testimony.
Hello, can you hear me?
Yes, we can hear you.
All right, thank you. My name's Elizabeth Moore, and I am a resident of Portland, a concerned citizen, mother, and full-time student. And I am here to adamantly oppose this ridiculous permanent mask mandate that you guys are thinking of implementing. First and foremost, I think it's pretty clear, especially from the testimony already given, that the people simply do not trust you guys anymore. We don't believe that you're going to take into account the best interest of Oregonians, and we don't believe that you're going to repeal this. I think it's high time at this stage of the pandemic, especially with Omicron, that it is time to let Oregonians be adults and make decisions for themselves and their families. Oregonians can make good decisions. We care about our community and we want to protect our community. And we can do that without the government and without health authorities telling us what to do with our bodies. I think there's a real issue with imposing this mandate and not letting people decide for themselves. Thank you.
Thank you. The next person on the list is John Marshall.
Hear me?
John Marshall, if you're on the line, can you unmute yourself?
Can you hear me?
Yes, I can hear you now.
Awesome, thank you. I appreciate the opportunity to testify today before this committee, and I feel that my comments are going to mirror many of those that we've already heard